Now we're going to move into Module 2, Understanding the Market. So let's get started. So let's do a quick recap of Module 1. We looked at really starting to build the foundation to give you all the information that you need on skin conditions, concerns. We went through some what inflammation is, chronic versus acute, and some treatment programs for acne and rosacea, getting you to think about what we're going to be focusing on as we go into our launch for Allcom. But before we can launch, we do need to understand those basics, and so we talked about that, our specific target, and again, what we differentiated as far as type, condition, inflammation, and again, our very specific focus in regards to the conditions we're going to be helping to manage when we launch Allcom. So for this module, we're going to take a look at the market. We're going to look at some common prescriptions and products that you'll see for these skin concerns. So teenage acne, diagnoses, over-the-counter products, and common prescriptions. You'll see in the parentheses in bold, those are the medical abbreviations for diagnosis, over-the-counter prescriptions. So I want you to get used to looking at those and knowing what they mean. We'll do the same for adult acne. And the treatments are kind of the same, so we'll put those two together, and TX means treatment, medical terminology. We'll do the same for rosacea, and we'll look at some triggers, and then we'll have some key takeaways. So again, let's look at the diagnosis of teenage acne. So again, by the time the parent decides it's time to take their teenager to the derm, they've usually tried everything they can get their hands on that they can find in the drugstore, online, their friends told them about, maybe even some concoctions they're making up on their own. So the general mindset here is they need to dry things out, and that's a big mistake. And this is really what it looks like. It's just overwhelming. And so there are so many products, there's no way that there could be a module just on what's out there. There's a million things. So remember, we're focusing on managing the symptoms of these chronic conditions, redness and inflammation, and that's what you need to keep your focus on. So common prescriptions. Remember, prescriptions are written to treat the diagnosis. We're offering a product to work in conjunction with the prescription to manage those symptoms of redness and inflammation. So remember those terms when you're speaking to your providers, your physicians, your nurse practitioners, your physician assistants, anyone that can write a prescription. We don't ever want to take that away from our providers. That's what they went to school to do. That's what they're trained to do. That's what they're paid to do. We are coming in with a product that works in tandem, in conjunction with, synergistically with. Adjunct therapy is another way to say it. So we're working alongside with them. So you need to remember that. And so according to the website drugs.com, these are the 10 most common prescriptions for acne. But there's many, many others that your providers may be writing. So this is not a module in pharmacology, so feel free to pause the module at this time if you want to write down what the category is of these drugs. I just wanted to let you know what they are, so when you're out there, you have an idea of what you're dealing with, so that you'll know that, aldactone is the brand name for spironolactone, and it's a diuretic, and it's used off-label. We're going to talk about that in a second. So as I mentioned, go ahead and feel free to pause the module right now if you want to take notes on this. So let's talk a little bit about what does off-label mean, because I'm sure you're going to get a lot of questions, and you're going to see what I mean in just a moment here. So what does off-label mean? If you're not familiar with this term, or you haven't been in the medical arena, what this means literally by the FDA is that the drug has not been prescribed nor indicated for the use or approved by the FDA for whatever the doctor is writing for. So it's been approved for something else, but the doctor or provider or the medical community has seen that this drug also works for something else. So everybody kind of does it. That doesn't mean it's safe or it's approved. It just means that the medical community does it and they're comfortable with their clinical judgment and with their licensure to go ahead and prescribe it off-label. It does carry liability on their part, but they're comfortable with their clinical judgment. So what if a drug is written by a provider off-label? Who takes responsibility? The provider writing the prescription does. So if something goes terribly wrong, you know, they're going to have to, you know, take responsibility. So why is this information relevant to Allcom? Why am I bringing this up? We highly anticipate your partners will ask you if Allcom can be used on other conditions besides acne, adult acne, rosacea, sensitive skin, some post-procedure skin that present with redness and inflammation. So any other skin conditions, something that comes to mind right off the bat for me, I would be thinking like eczema, psoriasis, probably just to name a few, or maybe even a sunburn or a rash. So what's your answer going to be? Here's your answer. Allcom is not indicated for these conditions. Why? Because we haven't studied the product on these conditions. So using Allcom off-label is the sole decision and responsibility of the provider. So when you say that to a provider, if you want to use it off-label, that's your clinical judgment. They know exactly what you mean and they will make that decision. So don't be shy to say that and don't say yes to something that you don't know about. If you're unsure, reach out and ask somebody. You can always reach out to myself. So adult acne, we talked about this in the previous module. So again, when you look at your literature, adult acne is 25 or older. However, by insurance companies, it's 18 or younger. So if you're over 18, insurance generally will not reimburse for anything acne related in a provider's office. Again, adult acne is a little bit different presenting wise as far as what it looks like on the skin. And adult acne sufferers may also get that rosacea in conjunction along with their acne breakouts. But unfortunately, the thought process here is pretty much the same. When it first starts occurring, off to the drugstore they go, they ask a friend, they order something off TV for the oils and the breakouts, and again, it's a big mistake because they're trying to dry everything out, and sometimes when they think they have rosacea, they're putting something on their skin that actually is shouldn't be used for rosacea at all if that's indeed what they have. So again, if they think that's what they have, they need to get to the doctor and get prescribed. So let's look at, I want to spend a little bit of time here on Accutane. I mentioned it in the previous module, but it's something that I just want to take you a little bit deeper on just because it's a treatment that you'll see out there when conventional therapy hasn't worked. So as I mentioned in the last module, at about that 6-month mark when things aren't getting better, again, they've already tried conservative treatment and they've talked to the patient or the patient's parents and they're ready to move forward, this is where they're going to go. So they're not really sure how it works on the cellular level, but that's not what you have to concern yourself about. I just want you to know just a few things about Accutane. It is an oral form of vitamin A. It is, again, when it's a prescription, when the patient's failed everything else, especially oral and topical antibiotics. And again, you see ABX, that's the medical abbreviation for antibiotics. And they're usually on it for from 3 months to about 1 year. And the thing that you need to know about that as far as treatment goes, anybody in the treatment room that does treatments on patients, whether it's acne treatment specifically or even anything like a peel, they'll ask if you've been off Accutane at least a year. So Accutane's pretty serious stuff. So they're on it for a year, but usually they have to be off of it for a year to have anything really, because the skin is so fragile after Accutane treatment. So as I mentioned again in the previous module, with every prescription, there's always a side effect. So you've heard them on TV, you've heard when they, you know, if you experience this, or this, there's always going to be side effects. One of the big things that Accutane users will tell you that it dramatically reduces the size of the skin's oil production. So what that means is to the patient is that their skin is getting severely dry, but everything is dry. They just feel dry, dry, dry from the inside out. Accutane does have anti-inflammatory properties. However, redness, the skin will feel redness and inflamed with initial use. So in the aesthetic world, they kind of call it that because Retin-A is topical vitamin A. This is oral vitamin A, and they'll call it that Retin-A glow. You can always tell when someone's on Retin-A, and it's kind of the same thing with Accutane. They just kind of have that overall red flush until their skin kind of gets used to it. The skin is very, very sensitive. And again, this is something they're taken orally. So it gets very tight, and it's because it's dry, it's itching, it's sensitive even to the touch, and can be very sensitive when they put anything on it. So it's they're getting all the benefits of having all that acne dry up, but again, there's side effects to that. Sunscreen is a must, very increased photosensitivity. And all other actives will be discontinued. So it's important just for you to know that they're not going to be on anything that's active, and they need everything that's going to be, protective and calming. So what's happening as far as treatments in the office when it comes to acne? So again, TX meaning treatments, so they can go in for pore cleansing facials, where they might do actual extractions in the office, and again, depending on the age, sometimes they can, just so that you know, for insurance purposes, they can bill for that. Chemical peels, salicylic and glycolic, so both have studies on helping with acne. Blue and red light therapy. So blue light kills acne-causing bacteria, and again, the abbreviation is P. acnes. Just so if you hear P. acnes, we all have it. It's just when you're having a problem, that's when the P. acne is a problem. So that causes inflammation, and again, the blue light kills the bacteria, and the red light helps with inflammation. Steroid injections, people will sometimes go into the dermatologist and actually have them actually inject a needle right into the cystic nodule with a steroid solution. It has to be greater than 5 millimeters in size, and it usually starts working right away. But that usually isn't reimbursed, and that's usually more, you'll see more adult people do that because they'll maybe get 1 or 2 large ones, but they can do that on the chest as well. So that's something that's also an option. This is called the Isolaz laser, and again, feel free at this point if you want to pause the module to write some of this down. This is just a laser that is specifically for acne, and it goes to the root causes for acne. So it does 3 things. It cleanses, purifies, and they're able to infuse products into the skin with something they call perfusion technology. So if you want to learn more about the Isolaz laser, you can go on their website and learn more about this laser. So products in the office for kind of all acne. So what are you going to, what is your patient seeing? What might you see when you go into your provider's offices? And again, there are a million things out there. So whether it's for teenage acne or adult acne, if you're in a provider's office, you're going to see many of the same products. But again, that's going to be dependent on where you are in the country. What you see on the West Coast might be different from the East Coast, from the North, from the South to the Midwest. So you're all going to see something different. But remember, we're focusing on managing the symptoms of acne and working alongside the providers. So that's what you really want to keep in mind. So again, there's a million products out there. These are just a few. So feel free to continue your research. So the diagnosis, again, we talked about this in Module 1. It does impact 1 out of every 20 Americans, 16 million people. That's a lot of people. The symptoms, the redness, the burning, the stinging, the inflammation, it's sensitive. Again, we don't know the exact cause, but UV exposure is the #1 trigger. This is a social issue. It's just like severe acne. This causes social downtime. This causes people to not want to go out. You can look at a couple of the statistics here. So 90% of rosacea patients admit their condition has lowered their self-esteem and their self-confidence. And you know, that's one thing we can help with them here at Color Sciences. We can help them get their chin up. And half of them say they have missed work due to their condition. So imagine that. So anyone that has severe breakouts or severe rosacea, you know, if that hasn't been your issue, then you don't know what that feels like. But if it has, you know exactly what I'm talking about. And we're going to help them manage that. So OTC is another, this one you might be more familiar with, over the counter. So again, there's a million. You're going to just be blown away if you do some more research. There's just one after the other. And I don't know what this guy used, but he burned his eyes out. Just kidding. I thought I'd bring a little levity. This can get a little dry, but there's a million products out there. My least favorite down in the right-hand corner, anything that has any kind of nut scrubs. That's not good on any type of skin, but especially skin that has rosacea. So again, they've tried all these things over the counter, and most of the time, none of them work. So common prescriptions. So again, keep in mind, and again, you can pause the module here if you want to take more specific notes, but what I want you to keep in mind here is we're working alongside the provider to help manage the symptoms of the chronic condition of rosacea. So they're writing prescriptions to treat the cause. We're working in conjunction to help them manage the symptoms. Okay, so I'm going to, again, this isn't a pharmacology module, but I do want to introduce you to some of the things that are out there and just get you familiar with what you're going to be dealing with. So we talked about Metrogel. That's one of the most common topicals that you'll see. It's indicated for inflammation, the inflammatory lesions of rosacea. Again, look at the side effects. So it's just like any pharmaceutical side effects. It's meant to help with the inflammation, but it can cause irritation and redness. You know, just what we don't want, right? We already have that. Finacea, 15% is another common. Again, this is to help treat the inflammatory papules and the pustules of mild to moderate rosacea. And this has not been studied for treating people with only redness from rosacea. So you can see that this particular prescription is for kind of the bumps associated with it, but not for the redness. So again, for both of these, I can see how we work very well in tandem with both of these prescriptions. And again, look at the side effects here. Burning, stinging, tingling, itching, irritation, and redness. So, you know, Mirvaso, I just wanted to call your attention. This, you know, because we're partnering with Galderma. This is a Galderma product, although it's not in the aesthetics bag. So our aesthetic partners aren't carrying this, but I did want to make you aware that that's who makes this. I don't want anybody out there, you know, putting anything down or talking, you know, oh, it causes redness. We don't need to do that. I'm just letting you know that this is one of the first and only FDA-approved treatments indicated for the persistent facial redness of rosacea, so that long-term facial redness. This is in the category of a vasoconstrictor, so it helps constrict all those vasodilated, you know, that first picture we saw back in Module 1 where they had that consistent redness, and you can see those broken capillaries. Those capillaries are just permanently, you know, dilated, so they're vasodilated. So a vasoconstrictor helps to pull that down. Now this is redness free for up to 12 hours. So I can still see how we'll work in tandem, because look at the adverse reactions. Erythema, medical terminology for redness, flushing, burning, and it can cause a contact dermatitis, and that's just like an itchy scaling. Dermatitis literally means inflammation of the skin. So again, Rhofade, another one. So again, this is by Allergan. This again is similar topical prescription to treat the facial redness in rosacea. Again, it's another vasoconstrictor for adults through 12 hours, and their clinical findings were on day 29. But mostly what I want you to know about these two is they're vasoconstrictors. But again, look at the adverse reactions. Site dermatitis, and remember, dermatitis means Anything itis means inflammation. Derm, skin, so inflammation of the skin. Worsening of the inflammatory lesions of rosacea. Application site pruritus. Pruritus is the medical term for itching. Application site erythema, redness, and it can cause pain. So again, remember we talked about the compliance issue. That's why it's so hard to stay compliant with treatment, because of some of the side effects. So again, products you're going to see in the office for rosacea. There are just too many. And again, depending on where you are in the world, they're going to be different. But just know they're out there. And you'll have to ask some great questions. If your offices carry these products, find out what's working. If what do they like about it? Are the patients repurchasing them? Because that's going to be a big telltale sign too. They might be carrying it as a product, working the way they thought it would. Are they hearing good feedback? Do they feel like it's really working? And we've said it, you've heard us say it, and we're going to say it all through the meeting. I'm going to say it now. There's nothing on the market like Allcom. So we really don't have a competitor, because there's nothing. There's all kinds of creams that are green. There's creams that are tinted, but there's nothing out there that's going to actually neutralize that redness the way that we're going to do it. And you're going to really, really see that. There's nothing out there that's got that SPF 50 and then all the great innovative ingredients behind it. So it really, truly is a one of a kind, and we need to make sure we give it the space it deserves out there. So all this is from the National Rosacea Society, rosacea.org. Again, a great website for you to do more research. Use it as a reference. It's a great site. As we discussed earlier, IPL/BBL, really kind of the same type of laser light treatment, is really being widely considered and used now for the treatment of rosacea. So telangiectasia is visible blood cells, so blood vessels, pardon me, so those capillaries, that's the medical terminology for that. And Dr. Philip Balin, this was actually on rosacea.org, they're using IPL to reduce extensive redness. So they do it over time to help take away that redness. It does come back, but then they can just repeat the treatments. But what I want you to understand here is that the treatment, whether it be acne or rosacea, it's not just one modality. It's just not, a cream or a pill or a laser. It's multimodality, or it's many things that have to work together to help manage these symptoms, along with whatever the doctor is prescribing, to help get to the root cause of what they think the problem is. Again, with rosacea, we're still not sure, and we talked about where they have to go with acne after conservative treatment has failed. But what I want you to understand here is that, yes, they're using the laser therapy for the red flushing, the broken capillaries, but at the same time, he stresses in his paper that medications must be continued to manage the bumps and the pimples that often go along with rosacea to help maintain remission. So there isn't a cure for rosacea. You need to understand that. We can only manage it. So he went on to say that generally speaking, it takes at least 3 IPLs at 6-week intervals. So they've got to really, again, stay on top of it and come back at the required time to see some results. So here comes that compliance issue again. The cost can range anywhere from $150 to $300 per treatment. So if you're looking at 3 treatments, that's almost $1,000. That's not everybody can afford that, and it's not reimbursed by insurance. So with an IPL, they're usually going to have some redness, some swelling, and it's probably going to be tender to the touch within the first day or so. And here's where we come in. So here's where the rubber's going to meet the road for us. What does this mean to you? So what, right? What this means to you is we've got to start thinking about integrating Allcom into our treatment room protocols. This is where you've got to put on your critical thinking hat and start to connect the dots. And this is what we're going to do a lot of at the meeting. So when they're thinking IPL and, kind of what is that life cycle, what's happening at home, let's do it in the treatment room. Let's talk about treatment room protocols. Some patients may also have some peeling. It depends on their skin and how sensitive they are. Some may have some bruising that can last up to 5 to 10 days. What does that mean to you? Pairing All-Calm with procedures, thinking about your proposals, your pull-through strategies, where are you going to place this, how are you going to help them with the sell-through. And it'll usually take about 2 to 3 weeks for those visible blood vessels to disappear. Remember, they've got to come back depending on how they set up their treatment plan. If they're going to do 3 treatments, they're going to come back at 6-week intervals. Because if you think back to that picture in Module 1, and you can always go back and look at that if you feel like you need to, that person had a lot of visible flushing. So I would imagine it's going to take at least 3 treatments, if not more. So what does that mean to you? Again, thinking about your proposals, your pull-through strategies, making sure that All-Calm is a part of the patient's home care regimen. So this was on rosacea.org, and these are some of the triggers. And I don't need you to memorize these. It's a lot. But here's what I want you to take away. Life triggers rosacea. I mean, we're all exposed to the sun, and life isn't worth living if you can't eat a jalapeno pepper every now and then, right? If you're, breathing, like I said, you're stressed out. And the thing about the human body is it doesn't know if it's a good stress or a bad stress. So it doesn't know if you're getting married or you're getting divorced. It's just stress. So your body doesn't know the difference. So if you think about all these things, people just want to live their lives. And that's why this is such an emotional condition. And so we can't cure the disease, the doctors can't cure the disease, but you can feel confident and proud that you work for a company that is going to help these people manage their life with a product like All-Calm. And it is going to be like nothing they've ever experienced, and they're going to be able to put it on and go, that's better. You may even have some real emotional responses. I've had that in the past with Even Up. I've had people crying at seminars because they felt like they just could never go out with the brown spots all over their face. And imagine, when we think back to those statistics, 50% of people have stayed home from work. 91% say they have low self-esteem. They don't have any confidence because they're red, they have pimples, they're embarrassed. And imagine they can put on a product and feel like they can go out and face the world. That's where you're going to make a difference. So up next, we're going to really dive into All-Calm. We're going to go on an overview. So see you at the next module.